Hi, I'm Lindsey Smith, welcoming you to Raise the Line with Osmosis from Elsevier, an ongoing exploration about how to improve health and healthcare. On this episode, we continue our Year of the Zebra exploration of rare diseases. Osmosis from Elsevier's Year of the Zebra initiative started about 2 years ago with a focus on raising awareness and creating accessible content surrounding rare diseases. To date, we have helped educate millions of current and future healthcare professionals, caregivers, researchers, patients, family members, and the general public about these zebra conditions. We are thrilled to continue learning more from other professionals in the rare disease field throughout this zebra-focused Raise the Line podcast series. I'm thrilled to welcome Dr. Marta Perez, a board-certified OB-GYN, to the podcast today. I first discovered Dr. Perez on Instagram, where one of her powerful videos on preeclampsia caught my attention. Dr. Perez has worked as a general OB-GYN for several years now and is now pursuing a fellowship in maternal fetal medicine set to graduate in 2025. Today, she lives in Austin, Texas, with her husband, who is also a physician, and their 2 kids. One of her children was diagnosed with a rare genetic condition called Smith-Magenis Syndrome at just 11 months old. Today, we'll be diving into her experience as both a provider and a parent navigating a rare disease. Thank you so much for being here, Dr. Perez.
Thank you so much for having me.
Well, I'd like to start with learning more about you and what first got you interested in medicine, particularly in entering the OB-GYN field. Can you tell us a little bit about that?
Yeah, ever since having to write my med school admissions, I reflected on how I just always wanted to be a doctor. I don't remember a certain point when I had an epiphany moment as a child or a family friend or loved one I looked up to. I'm one of the first people in my family in medicine. I just kind of always wanted to be a doctor. And when I kind of set my sights on something, I tend to be someone who just goes after it. I did have some wavering doubts in college, but then ultimately decided, nope, medicine is the path for me. For OB-GYN, that is a decision I made 3rd year of med school when I was on my rotation. So I really loved kids. I had thought that maybe I wanted to do pediatrics, but I had a really open mind because I had heard other medical students and other doctors say, you have to wait until you're really on the wards and seeing what everything is about before you make a decision about what kind of doctor to be. And I loved my pediatrics rotation, but when I did my OB-GYN rotation, I just said, this is it for me. I can't imagine anything else for myself. So I really enjoyed all my rotations in medical school. I loved medical school so much. And OB-GYN is just the one that just captivated me and made me the most excited. So that's what took me to the path I'm on now.
It's always so interesting to hear how people got started into the medicine field. Thank you for sharing that with us, and really enjoyed knowing that from a young age that you knew that you wanted to be in some sort of field in medicine. So thank you for that. Can you tell us a little bit about where you are in your medical education journey today?
Yeah, so I had a really kind of traditional path up until kind of the end of my medical training. So in college, I was pre-med. I went directly into medical school. Medical school is pretty traditional path into OB-GYN. But then things went a little differently. I debated being a general OB-GYN or going into MFM, which is maternal fetal medicine specialty fellowship. OB-GYN residency is 4 years and MFM fellowship is 3 years. So it is adding a lot more training onto residency. And I do really like the gynecologic aspect of OB-GYN. I like fixing women's painful or heavy bleeding from their periods. I like contraception. I like doing surgery. So initially I was like, I'm not sure if it's worth the extra training. So I graduated, became a general OB-GYN. But then ultimately, after a few years, I said, you know what, I think maternal fetal medicine really is for me. So came back to fellowship. And now I'm in my 3rd year of maternal fetal medicine fellowship.
Can you tell us a little bit about kind of the difference between those 2 tracks that you just mentioned and what you're really focused on in maternal fetal medicine?
Yeah, so a general OB-GYN, many listeners will be familiar, especially female listeners, with what a general OB-GYN does. They do all sorts of reproductive health care. There are many different types of jobs you can have, but most people will take care of both gynecologic problems like heavy bleeding or painful periods or fibroids, do gynecologic surgery, hysterectomy, minimally invasive surgeries. They will also do obstetrics, which is the care of pregnant people and their deliveries and postpartum. And then there's some other things thrown in the mix like preventative health care, pap smears, cancer screenings, et cetera. But maternal fetal medicine is a specialist in high-risk pregnancies. And so maternal fetal medicine specialists, or MFMs, they used to be called perinatologists, are really experts in complicated maternal health issues in the pregnancy that the mom either has outside of pregnancy, something like lupus or type 1 diabetes, or things that develop within the pregnancy like preeclampsia, as well as being the expert imagers of the fetus and managing fetal health. So we're the ones who do the expert levels of fetal assessment with like anatomy scans on ultrasound or management of other fetal conditions like growth restriction or complicated types of twins, things like that.
Thank you so much for giving us that great description of the difference. That was very helpful for all of our learners and especially me there. I'd like to switch gears slightly to discuss how your professional and personal life intersect a bit. You have a daughter who is diagnosed with Smith-Magenis Syndrome. Can you tell us a little bit about your daughter and really what Smith-Magenis Syndrome is?
Yeah, absolutely. So Smith-Magenis Syndrome is a genetic disease that results from a small portion of one of the chromosomes in our bodies being missing and causes kind of a variety of different health problems. Some of the health problems are physical health problems. For example, she has strabismus, which is her eyes deviate in, that she wears glasses and also has had to have some eye muscle surgeries for. And other problems are really intellectual disability, other neurobehavioral differences that affect the way she sleeps, the way she behaves, and the way she develops. So she was diagnosed just before her first birthday last year after she had failed to meet many of her 9-month milestones at her general pediatrician. So she underwent a workup for why she was missing these milestones, which resulted in a genetic test called a chromosomal microarray, which was able to pick up on this section of chromosome that was missing. Smith-Magenis syndrome is rare. I'm a doctor. My husband is a physician as well. Neither of us had ever heard of it. We have many medical specialists now involved in her care, and only one of them has really ever heard of it. Many of the other doctors have not. And so it's definitely been, it's catastrophically challenging to hear that your child will have a completely different life than the one you had thought about or hoped for. And then in consequence of that, both you, your family, their siblings will as well. And so it really changes everything about how you kind of need to approach life financially, emotionally, and just kind of setting up things like that. So, we absolutely love her. She is a joy, but she's also given us huge challenges. She needs lots of therapies, lots of doctor appointments. It's always kind of a juggle trying to work around 2 doctors' schedules and her needs and her therapies, but it's something that my husband and I approach as a team. But it's definitely given me a very different perspective in medicine to really, really be on the patient side now.
Absolutely. Thank you so much for sharing that. And one thing you touched on is, the current therapies and doctor's appointments that you're working with for your daughter. Can you talk a little bit about what the current plan is for those therapies?
She's in physical therapy, occupational therapy, speech therapy, because her developmental milestones are and will continue to be delayed. She just started walking at about almost age 2. And so keeping her in those therapies helps her work with professionals who know how to support and encourage some of those developmental challenges.
You also mentioned that you and your husband are both physicians, navigating the healthcare system to make sure that your daughter is getting what she needs. You mentioned that you always are on the patient side, but I was curious to know what observations you have about the medical system and how, we approach patients with rare diseases. I guess that's the first part of the question. And then the second part would be, what advice do you have for other parents facing the same challenge?
Yeah, so I think, my first introduction into it was before she even received her diagnosis, because I spent probably 14 hours on the phone trying to get the genetic test approved or figure out the prior authorization that hadn't been sent initially. And I often interact with patients who are having frustrating experiences with our healthcare system, particularly regarding insurance companies. And it's really difficult for patients to understand what the roadblocks are and how to surmount them. And it's hard for me too. There are hundreds and hundreds different types of insurance plans, and no doctor can understand them all or be able to predict for a patient what their plan will or will not cover. That's just outside the scope of what really any one person can do, even someone who specializes in trying to figure out medical insurance. So most insurance plans do offer someone like a patient advocate, and I got that person involved. She helped make phone calls when I wasn't available because, I have a job. I am not always available to sit on hold for hours at a time, which was what was required for this. So she really helped out a lot. But to remember that your doctors are just as frustrated as you are. My doctors who saw my daughter were really frustrated on my behalf that I was having a hard time with this, but there's nothing they could do because just the relationship between insurance companies and lab companies, it just is also complex, and it is really challenging. And just to prepare yourself, I told my husband there's a morning about my child having an illness, and there's the morning that I'm going to have to be dealing with insurance companies so much more intimately than just routine care for so long, forever, probably. And that was really frustrating to me because I know how difficult it is and will continue to be. And I don't get an easy out just because I'm also a doctor. I also have an insurance plan that puts up roadblocks to me accessing the care I need for her. The second thing I would say specifically for rare diseases is it can be really, really challenging. Her Smith-Magenis Syndrome is rare. There are not large trials on what are the optimal medications or regimens to treat or help ameliorate some of the symptoms. There are similarities between Smith-Magenis Syndrome and other more common disorders. But often medications for rare disorders are extremely expensive because, a company has to make some profit off of very few people taking the medication, which is reasonable. So the insurance company says, well, it's not approved for Smith-Magenis Syndrome. And we're currently going through this with a medication right now. And we have to say, well, I know because we'll never be able to do a trial in Smith-Magenis Syndrome because there are so few people that have it. And there aren't the resources to devote to Smith-Magenis Syndrome and other rare diseases. But look at the similarity with this other condition. The symptoms are very, very similar. Everything looks very, very similar. We expect that it will help with our child as well. But ultimately, that may or may not be something that someone at an insurance company agrees with. And it also may or may not be something that every physician may be open to. My husband and I have had really good experiences with many of Carolina's doctors, and we've had some, unfortunately, negative experiences too, where a physician almost seems to just shut down and say, well, that's not something that happens with that syndrome. And instead of kind of being open and listening to what our experience with our daughter might be, or how it may be different than a normal child, or how it may be similar to a different genetic disease. So it's awful to say this, but every time I've talked to another special needs parent, it's something we all have in common, that we've had really dismissive experiences with doctors. And for my husband and myself, that's been something really formative for us and how we approach patients in our own practices, and just our own understanding that we understand the other side, the stresses in medicine, the kind of way a mind works of putting things in boxes. But we just have to say, we're our daughter's biggest advocate. So it's definitely, I think has made me a better doctor, or I hope that it has. But it's something that I know would be even more frustrating for parents who are not in medicine and maybe find things more confusing and more difficult.
Absolutely. I want to kind of circle back on, you had some great advice for parents that are in a similar situation. I want to kind of flip the question a little bit to our audience, which is early career health professionals, and wanted to see what your advice is to them about meeting the challenges of the moment and approaching their career in healthcare.
Yeah, so I absolutely love my work. I love being a doctor. I love getting to see and treat patients and getting to make a big impact in people's lives. At the same time, it is hard when two healthcare workers, healthcare is typically a job that lacks a lot of flexibility. We really have to be there for patients when they need us. A lot of nighttime work, weekend work, holiday work. So having two people in medicine can be challenging, but we both love our careers and we're both committed to feeling happy in our careers and being present and available spouses and parents. And I think that we've done a pretty good job so far, and we're going to continue to. But I think the important part is always kind of looking inside and reevaluating what balance do we need and how are we going to keep the other person balanced. In our particular case, in our marriage, there's times when I'm working a lot more and my husband does a lot more at home. There's times when he's working a lot more and I do a lot more at home. So the key for us has been communication. And I think in a partner, whether they're in healthcare or out of healthcare, or they're going to be the one because your schedule is so unpredictable that can't actually have consistent work, then just making sure that communication is open, because there's both being in healthcare and being the spouse of someone in healthcare is challenging. And making sure that your communication is open is, I think, one of the best parts. And for people who don't have partners yet, it's totally possible to do it and to have a family. And you just might have to think a little more creatively sometimes.
I love how you said that about the balance and the communication piece there. Those are really important aspects for sure. And I'm not sure how you're juggling it all, but it is quite impressive on how you're managing to do it all. So a big kudos to you on that. So our final 2 questions for you. At Osmosis, we are an education and teaching company, and we love to fill knowledge gaps wherever we can. We make exciting, engaging videos on different topics. And I wondered if you have a topic that you think Osmosis should make a video on to maybe fill a gap that is of particular concern or interest to you.
One of the things I most enjoy teaching medical students about is pregnancy and pregnancy physiology. So oftentimes as an OB-GYN, I see really well-intentioned healthcare providers tell pregnant patients, well, you're pregnant, so I don't know what medication to give you. Or you're lactating and breastfeeding. I'm not sure if this would be safe. Don't take it. Or just throw out your breast milk for a while you're taking it. And that's probably one of my biggest frustrations, because I've never seen someone who has like kidney disease or an allergy to an antibiotic. I've never seen them just told like not getting care or to stop getting care, or that someone wouldn't give them a treatment that was indicated. Usually that person just goes and says, well, what's the dosage of this medication with kidney disease? Or if they're allergic to this medication, what is the next best alternative? And they proceed down that path. But for some reason with pregnancy, there's a lot of fear. And overwhelmingly, most medications are safe in pregnancy and breastfeeding as well. Telling someone to pump and dump is actually creating harm for them and their baby, especially when it's not needed. And the next thing is that many, many resources exist to figure out if the medication is safe, and if not, what the next best alternative is. That just because someone's pregnant does not mean that their fetus is very, very small risk, even if it's there, which many times it's not, is more important than the pregnant person's health condition. In fact, it's usually the opposite. If you're not ideally treating a disease in pregnancy, that's going to negatively impact the pregnancy and the fetus as well. Oftentimes, way more so than any small risk that a certain medication might have on a developing fetus. So one of the best things I like to teach medical students is like, think of pregnancy like a standard antibiotic allergy and figure out what the right treatment is, and do not just withhold treatment or say that you're uncomfortable with it. And then, of course, OB-GYNs and maternal fetal medicine specialists are always there to help you manage things, but certainly treat pregnant people as if they're real people, because overwhelmingly, if you're improving their health, you're also improving the health of the pregnancy, not the opposite.
Thank you so much for that. Those are some great topics you covered there, and we will be sure to pass that along to our content team in hopes of getting some more videos in the pregnancy space. My final question for you is there anything that we didn't cover that you'd like us to cover?
No, I think this is a great opportunity to both talk about, being in medicine and healthcare, and at the same time being a parent of a child with special needs, because there's all sorts of surprises that life throws you. Being in healthcare yourself doesn't protect you or your loved ones from illnesses or surprising diagnoses. And it really brings the humanity back into medicine to recognize that we're all struggling and we're all affected in different ways. And that the person in front of you, when you're on the provider side, is hearing things and processing in their own way.
Thank you so much, Dr. Perez, for joining us today.
Thank you so much for having me.
Dr. Perez is a remarkable resource, not only for the medical community, but for parents navigating everyday challenges. If you're eager to learn more about pregnancy, birth, and reproductive health, I highly encourage you to explore her invaluable insights on social media. You can follow her on Instagram and at YouTube at Dr. Marta Perez, spelled Dr.Marta altogether. I'm Lindsey Smith. Thanks for checking out today's show. Remember to do your part to raise the line and strengthen the healthcare system. We're all in this together.
If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our episodes at osmosis.org/raisetheline podcast.